Hello, everybody. So, I don't normally talk about my personal things. I mean, this is the internet, things stay on the internet. But I'm just going to tell you about something that was pretty scary that happened to me a few weeks ago. So, the first part of this was that about maybe 4 months ago, um, some builders decided to work on what had been a vacant lot next to our house. So, it had been vacant for 15 years or so. The people that originally owned it died. Their parents, their children took it over, and they wanted to sell it, but they couldn't. I'm not even sure. It might have been more than 15 years. They eventually sold it, and the company that bought it wanted to build what's called a disability home. So this was a 9 bedroom house, so a single house. So uh, the block of land was actually big enough for two 3 bedroom houses, and most of the places in our street have one at the front and there's a small little driveway down to the one at the back, and you get a 3 bedroom at the front, 3 bedroom in the back, 6 bedrooms. But this was 9 bedrooms, so they've managed to squeeze in an extra 3 bedrooms by crowding it in. Now I don't actually know what kind of disability house there is because they haven't finished it, but it could well be people that need wheelchairs. It could be mental health people. We don't actually know. Um, I know that I've known people that have lived in disability houses, and a lot of them have been mental health issues. It could be people with depression, people with schizophrenia, um, autism, um, people that Down syndrome, people that struggle and need help. And generally, from what I'm aware of people that I've known who've lived in those sort of homes, is that they're generally independent. So they live by themselves, or with the 9 of them, as presumably. They don't have a carer on site. They don't have a nurse on site, and so they're usually people that are pretty good at being able to take care of themselves, and they rely on each other, which is good. That's what you want to hear. And then they have people come in during the day to take care of them. Now, this is the people that I've known that have lived in this sort of facility. So I've known people that had those sort of disabilities. That's what they have, and some of them will, of course, they'll have people that will come by. They might be volunteers or they might be paid, and they might take them on little excursions. But they don't always. Some of them are quite independent and they just do their own thing normally. It depends on their situation. They might only get visits maybe once a week, maybe once every 2 weeks. So these are usually adults. So that's what it looks like. So they'll have wheelchair access because some of them will have wheelchairs, but it might only be one or two out of the 9. It probably won't be all of them. We actually have a few others in other places reasonably close to us. What's unusual is that this is actually between two houses that are not disability houses, because the ones that I know of are usually a bit away from everyone else, so they don't disturb people because they have certain needs. They might be a bit loud, they might be making noise during the night. Now, of course, we don't know what they'll be like because they haven't finished building. They've probably got another 6 months left. Now, I'm someone that I have a few allergies, and one of my allergies is dust. And this is quite a serious allergy for me. And so, fairly early on, when they were doing this, I started coughing. Now, I cough from dust all the time. I take something called Symbicort. I'll just show you here. This is Symbicort inhaler. I'll actually take one now, even though I don't actually need one. A bit naughty. Go like that, one twist. And if I was in respiratory distress, which I actually wasn't, so I probably shouldn't have taken that. But that would cure it straight away. So I'd go from to straight away fine. And that's how it works for me. Now, it works differently for other people. I'm not going to say that that's a cure-all for everyone. Depends on your situation. For me, that works when I'm in respiratory distress. I'm actually supposed to take some water. My cat's sitting on my lap. It's a bit hard to do. But yeah, so that works for me. But with the level of dust that they had, it actually wasn't working. It wasn't enough. So I was coughing a lot from that. And that's quite problematic for me. And that's not normal. That's not within my range of normal. That's worse than my peak levels. So, of course, because it's allergy driven for me, I don't cough every day. In fact, I can go 2 or 3 months no coughs at all, and then of course I can have 4 or 5 in a day. And it probably averages 1 to 2 per day, maybe not even one, maybe 0 to 1, maybe half of one every 2 days, that sort of thing. But it's not consistent. It depends on what I'm exposed to. So with their building, it went up to about 10 per day, which, when you're averaging sort of 1 to 1.5, 10 a day is an obscene amount. And now, okay, that's only $7.70 for a puffer, gives me 120 puffs, 10 per day. We're talking about 50 cents a day. We're not talking about a lot. It's not killing me financially. But it was very annoying to have to do that. And of course, I'm only allowed a certain amount. And even though I don't actually use the amount that I'm prescribed, because it's prescribed based on the idea that I've got asthma, I don't have asthma. I have allergies, and that therefore means I'm supposed to average 2, and I don't actually average 2. I average maybe 3/4 of 1 per day, so I actually end up with more than I need. But long term, I'm going to run out, and that means I'm going to have to pay full price, and full price is like $100. I don't actually know, but it's a lot more than $7.70. So not great to have this all the time, and quite annoying. It's not life threatening, but it's quite annoying. And a little bit, like after about, I think, a month, they'd been doing this, and I developed a rash all over my body. And this was a horrible rash. This was a rash that meant that I couldn't sleep. It meant I was just itching like crazy, and I scratched myself. You say, you didn't have to scratch yourself, it was a rash, you could have left alone. If you have a severe rash, you have to scratch it. I'm sorry. This is just the reality of the situation. And you tell me, don't scratch it, you'll spread it. That's not how rashes work. Now, it might be if you only have a rash in one part of your body and it's a poison ivy sort of thing, a contact rash. You scratch it, and then you scratch it somewhere else and it spreads it. But this wasn't poison ivy. This was all over my body at once. Scratching it relieves the symptoms. Now, I still have scratch marks on my body from this, and this was like 4 months ago, 3 months ago. Not actually quite sure exactly how long ago. And so I had to go to hospital with this. The hospital people were quite incompetent with dealing with it. They just decided not to give me anything. I was like, but don't you have on your record what I can take for this? Because I've had these before. Don't expect me to remember, do you? I said, well, you can't take anything. Bad luck. You're just going to put up with that for life. What? You do a test? No. You're just going to have a rash for life. What the hell? I mean, seriously. I'm here with a horrible rash that I'd had at that time for 10 days. Have a history of serious rashes, life-threatening stuff. And they discharged me with nothing. I mean, are you kidding me? They're like, oh, you're allergic to everything, we can't give you anything, bad luck. I'm horrified. They could have easily done some tests. They didn't put me in to test me, to send me home. Now, luckily, when they were talking, I overheard them. And I heard them say a thing called Phenergan. And lucky this triggered a bit of a memory. And I go, oh, I can take Phenergan. So I went to the chemist and got myself some Phenergan. And then I remembered I can take chamomile lotion. I was not allergic to everything, I'm sorry. That fixed it in 2 days. Maybe 3. And mostly in 2 days. There were a few little remnants for the 3rd day. So I was just thinking, they weren't horribly cruel, but they just didn't bother. And I'm just shocked at the incompetence. And I have to say this is incompetent. I know you're not supposed to say names on internet at stage for. This was Sunshine Hospital here in Melbourne. This was Sunshine Hospital who, and look, I know that emergency department that's where the worst of the doctors go. That's where if you're first trying out as a doctor, you go there. It's the case for any emergency departments anywhere. You want good quality attendance, you go to outpatients. Want really good quality, you go private. You know, hospitals are where they learn things. Even private hospitals are not as good as private clinics. Private specialist clinics is where you get the best quality. Even considering all of this, like I was there for like 10 hours with no treatment. I was just scratching myself like crazy. I got nothing. I mean, my history of allergies suggests this should have been top priority. I got no treatment. I was sent home, no medication, no attempts to give me anything. Just tough luck you're going to have a rash for the rest of your life. No referral to a dermatologist or an allergist or anything. Just nothing. No discharge summary, nothing. And I have to actually say that Sunshine Hospital have been horrendous since I moved to this part of Melbourne. I mean, I've been to other hospitals in Melbourne that were much better than this, but I've lived in other states. Their best performance was still worse than the worst I've had anywhere else. And their best performance was when I broke my toe, had to wait 15 hours, and they bandaged it up. That was their best performance. Barely adequate. But you could say, well, it wasn't life-threatening. It wasn't in enormous pain, it was just a broken toe, big deal. I mean, the amount of time they spent was a bit ridiculous, but it was probably the right treatment. And they're getting worse. I mean, I went in there with a bee sting once, like bee stings are fatal for me, and they just ignored me. And then they said, oh, you didn't have a bee sting, you had poison ivy. Now, I don't know, maybe I did have poison ivy or something like that, but it looked like a bee sting. I didn't see the bee, I didn't feel the stinger, I had my headphones on. Chance it wasn't a bee sting, but just the callous disregard was appalling. It could have been life-threatening, it could have killed me. And they did not even try to adhere to their duties. And this is a consistent thing with them, at least with me. I obviously can't say if they're good for other people, but this is a bad hospital. This is just appalling. I mean, I'm someone, I have a red alert. And this is nationwide, I have it in every hospital. Except for Sunshine, who don't give a red alert means basically I would go in and I'd be seen straight away. It's because I have a number of quite serious health issues, mainly allergies, that are potentially fatal. Sunshine Hospital go, don't care. But they don't just regard me as the same as everyone else. They actually take me with serious issues and put me below everyone else. So have the opposite of red alert. Red alert gives you special treatment. They give me special negative treatment. Just go in there and just say I'm a liar about everything. Say I'm a liar about a red alert. They've said I don't have allergies. Said I don't have all these things. And they put my life in danger every time I go in there. So I'm very reluctant to go in there. So I'm trying to think of the date, but so about 6 weeks ago, I developed a cough. Now I just said I had a cough, but this is a different cough. So this cough happened. So I watched an episode of The Golden Girls. I don't know, that was like 40 years ago. I'm not sure actually which year. 1986 maybe. 39 years ago. And it was on, so like obviously on record, but it was streaming. We just watched it. And I was eating the chip and just coughed, swallowed, got stuck, started to choke. Now it wasn't one of these life-threatening chokes that some people get sometimes. You can get chips stuck in the windpipe and you choke. This is more of a all fine, but then a little bit of it stuck. Now I don't know if anyone's had a little bit of the chip stuck. So for me, So I pointed out, it's about there. My windpipe is twisted and narrowed, and this happened when someone punched me about 15 years ago. And since then, things get stuck a lot more than they should. So normally, it wouldn't get stuck, or it gets stuck briefly. You'd cough it up, you'd all be fine after 30 seconds. But for me, it doesn't come out. It doesn't go all the way down. It doesn't disintegrate. It just sort of gets stuck there and gets infected. And the infection usually takes about 2 hours. So I've had like 12 of these. And I used to have them happen all the time, but I've since sort of changed my eating habits, try to avoid laughing. So the last time this happened was about 4 or 5 years ago. So I managed to avoid them. And the time before that was probably 3 years earlier than that. And, but it used to be like every 3 or 4 months. They just come back. And the thing with this is that it doesn't go away. It never goes away. It just stays with me. It could be a permanent thing. If I didn't take medication to intervene, it's permanent. I just cough for the rest of my life, which is annoying. It's not going to kill me, but it's annoying. I don't go to the hospital for this. I never have. Because things are annoying, they're not life-threatening. So I didn't go to the hospital over this. I went to the GP. But my GP now has a 10-day waiting list. Because the clinic that I went to went from 6 doctors down to 3. And from a 2 or 3 day waiting list out to 8 to 10 days. So I had to wait 10 days. And when you've got something where you need medicine to resolve it, you need medicine straight away, having to wait 10 days is a problem. And the medication, of course, was amoxicillin. It's a type of antibiotics. I just have 2 courses, it goes away. Of course, a lot of GPs want to give me one because they say, we don't want to make it antibiotic resistance. That's for a virus. This is not a virus. It's not contagious. I've inhaled a chip. Antibiotic resistance is not relevant. I just need to raise my voice there because some of the people at the back, these doctors who should know better, just get a blanket rule. And they keep doing it. So I've become so frustrated with this over the years that I've just decided to do something that I know you're not supposed to do, and that's do doctor shopping. So I see 2 doctors. Because I know I need two courses. See, one for the first course, one for the second course, and I'd usually see them same day as each other. So they was, I've got this thing, I need some antibiotics, and they give me 1 course, even though I need 2. Oh, I need this thing. They give me 1 course, even though I need 2. Combined, I get enough. This time when I did it, I went to see one doctor, and it was one I haven't been to for a while. They charged me $150 to see him because I hadn't seen them for 5 years. Bit of a scam there, but anyway, I saw them. I said, no, it's just an allergy. What? It's clearly not an allergy. You idiot. So then I had to see the other one after 10 days. And I went, could I go and see a third doctor and try to work it out? When I stuff it, I'll just tell this one the truth. And it gave me 3 repeats. It's great. 4 courses, I only needed 2. So good, don't have to doctor shop. Went to the pharmacy, and they said, you can't get 4 courses of this, no. Gave me 1. Didn't tell me. Got my wife to go back for the second one, and she said, they're not giving me any. So then I had to go back to see him. Another 10 days. Plus the gap of having that. It's 15 days. It's a 10-day gap. I need to have these next to each other. I can't have a gap. Have a gap, need to start over again. Go back to see him. And he's quit. Go to see another GP. And then, we don't want to take it on. I've seen 5 different GPs. Now, they're from not his centre, but a different suburb, but the same clinic. And they're like, "Oh, you got to go back to your home one. We're not taking on new clients." Or, you kidding me? So that's bad enough. So I still have this cough because I can't see doctors because they're like, "Oh, we won't take on a new patient. Oh, you need to go to your home suburb." I've travelled for 40 kilometres to see you guys. At least see me. No, we won't see you. And doctors should be smart. They should be smarter than this. They've got my notes. They know. But they're not doing it. So then what happened was that I went down to lie down. I'm on my side, as you do, or on my back, on my front, whatever, but horizontal. And 10 days after I swallowed the chip, after I got my antibiotics, I suddenly couldn't breathe. So I'm on my side, I couldn't breathe. And I had a total airway blockage. So it didn't, not shortness of breath, but just no breath. Nothing. It's about 2 o'clock in the morning. I woke up. I want to scream, nothing's coming out. And I had a pretty big panic. And the panic got worse and worse. And I'm like, what do I do? What do I do? Didn't know what to do. And I couldn't talk. My wife's sitting right next to me going, no idea that this is going on. I try shaking her, but I can't talk. So I just go there and go, what do I do? I had no idea what was going on. So I just had the idea. I just leaned forward and I started trying to cough and trying to breathe as hard as I could. And after about 3 or 4 minutes, I finally did a cough. And I'm going to demonstrate this, so apologies for this. And it took me about 4 minutes to get up to the level of this. And finally, whatever was causing the problem dislodged. Now you might say, well, what was it? I'm not aware if anything came out of my mouth. I didn't see anything, but it came from here. This was obviously, the blockage was down here. So it may have gone up to there, or may have gone to there. There's a lot of room like between there and my mouth. Like that's 6 inches, 15 centimetres, roundabout. So it could have been halfway. Could have come out. I never saw anything. I didn't see anything. Like, I obviously wasn't looking because I'm too busy trying not to die. And, I didn't really look. But I never found anything. So, okay. So then I had 4 more of these. So 5 total. And they were terrifying. I thought this was an allergic reaction to something. I wasn't sure what. But that was what I assumed. I'd had some medicine. He gave me some steroids. And I never had these steroids before. It's called prednisolone. I thought it was an allergic reaction to prednisolone. Because I'd had corticosteroids before. I'd had an injection in my arm. And it had swollen up like about that much. Which is a fairly minor reaction. As far as allergies go, that's not one of the ones I'd really worry about, but they banned me from taking corticosteroids over it. And I sort of went, I'd forgotten that I had that reaction. It was such a minor reaction, really, compared to how they go. And also, my good old friend Symbicort, which is the best inhaler I've ever had, this one has steroids in it. So why am I inhaling something with steroids in it when I'm allergic to steroids? Why is a corticosteroid swelling up that much? Well, maybe not quite that much, might have been that much. Why is that swelling up? Why am I getting a reaction to prednisolone when Symbicort, which has a little bit of steroids in it, is not giving me a reaction? Well, there's a few explanations for this. One is the amount of steroids in that Symbicort is very small. Second one is it's inhaled, and that can have a different result to injected to pills. So inhaling pills and injections, 3 different things. You just ask someone that's taken cocaine. You can lick and eat cocaine and it does virtually nothing to you. If you sniff it, what? That gets you high, and if you inject it, it just straight up kills you. So sniffing gets you high, injecting kills you, eating does pretty much nothing. Now, I've never tried any of them for cocaine. I don't think so anyway. I think I might have had something with codeine in it. Didn't react well with me. I don't try drugs because when you have so many allergies, it's too big a risk. I go, this is nice, die. Just not worth it. If drugs were legal, maybe I'd have a go, but just not worth it for illegal drugs. And I'm not saying that nobody should take illegal drugs. That's up to you. That's your choice. And of course, there might be some legal sanctions. But I'm not taking an ethical stance. I'm just saying for me personally, it's pretty stupid to try any of that. Because if you have lots of allergy and you don't know what you're allergic to, and you can't obviously be tested for things that are illegal, I'm probably going to just die if I take one of those things. So, yeah, don't take them. I don't. I'm not saying for no one else to. But suffice to say, I thought it was prednisolone when I first had that reaction, and I thought I was going to die. I thought, I'm probably going to die in the next half an hour or so. Didn't think there was any point calling the ambulance, not to mention the Sunshine Hospital's pretty horrendous. They have been particularly hopeless for me. Terrible. And I didn't think there was any point, and so I wrote my will. And I'd never written my will before. I just decided I'm going to write what I want to have happen to my money and all that sort of stuff. Try to write as quickly as possible, and that was just what I spent my time doing. 6 hours later, you might think, you're probably fine after 6 hours. Still writing it. My wife woke up and, explained the whole thing to her. And then I had some more of them. So I had 4 more. They weren't in the same day. They're pretty much in consecutive days. And at first I was thinking, well, this is just prednisolone. It's still in my system. But then I sort of went, hang on, it should be out of my system by now. And I didn't know how long it was going to be in my system. And I went, And the thing was also, and I was thinking about, should I go to the hospital? I sort of guessed how they'd react, and I was right, by the way. I thought, okay, I've just nearly died, but they're going to turn around and go, you're not dying now, don't come here. And I was right, of course, because this is their behaviour. Now, other hospitals would treat it much more seriously, but that hospital is pathetic and awful, particularly with me, and they would not they would not care. Unless I was in the middle of choking, in the middle of unable to breathe. And how am I supposed to call them? And how are they meant to get there and drive me there in like 2 minutes? Because any longer than that, I'd just be dead. And even if they came, let's say they came here in 10 minutes. It's lasting 2 minutes. Well, it lasted 3 minutes the first time. Subsequent times I've worked out, when it comes, I cough as hard as possible straight away. Go straight away to... Sounds awful, by the way. But when I can't breathe, you don't hear anything. Right? But that is the level that it takes to cough up from here, and that's where it's stuck. That's where the blockage is. The blockage is here. Now, you could tell me, no, but how do you know it's not there? It's there. I know, because that's where my throat is twisted and narrowed. I suppose I don't know, but because I can't literally go in there, pull my eyes out, put them in there and have a look. But I can feel it. You can feel it, and maybe my feeling's wrong, but that's where I feel it is. And and I know what they would do, and this is how they have done it for everything that I've dealt with. They'd be like, "You're not dying. You're fine. Go home." So why bother? So what I actually went in there for was not for those total airway blockages, which is I could die from them. I didn't go for them because I knew how their pathetic, awful behaviour is. I knew how disgusting, uncaring they are, at least for me. So I went in there when I had something worse than that, which was my throat starting to seal itself off. This is worse because this was more permanent. I went in there for that. They didn't care. They didn't check. They didn't care. They left me in the waiting room for 14 hours. Nobody checked. And they didn't care. You know, after 14 hours, I said to them, I've run out of antibiotics, maybe just give me some more and it'll probably help. They refused to give me any. They told me I had a cold. Now this was at this stage, I think we're up to 17 days that I'd had the cough. Now someone can explain to me how long a common cold lasts. Does it last 17 days? No, and it probably wasn't a common cold. Because they didn't trust me that I had it for 17 days. They said, well, you probably only had it for a day. You're lying. They did a test for respiratory viruses. Now, they kicked me out at 10:30 a.m. The test came back at 3 p.m. So 4.5 hours later, came back negative for cold, influenza A, influenza B, COVID-19, and 4 other viruses. And I didn't get told what the other 4 were that they tested. So the 8 most common respiratory viruses all came back negative. Not only that, but my GP had tested me for them a week beforehand. And I showed them that test, which was from the same, what do you call them? The same group that checked them. And they ignored that, did their own test, discharged me based on an assumption. And the assumption was wrong. Now, I didn't die, luckily, because the thickening of my throat went from there and it lowered a bit. But they'd made it clear they didn't want to see me. Got my second lot of antibiotics, but there was a gap between the first and the second. And then that GP left. Can't see him anymore. So if that second one didn't work, not getting any more. I actually only had one more case of a total airway blockage. It was actually a 9-day gap, and I thought I wasn't going to get any more. I thought the antibiotics had stopped it, but then came back. I had another one. And the other one was associated with another thickening in my throat, where it started to seal itself off. It goes from right to left. And so I went in there going, well, you know, I've probably got minutes to live. Will you see me? No. They wouldn't see me. Minutes to live. Who cares? And on that case, yeah, I was. They didn't do another respiratory check. This time they decided that I shouldn't be on Symbicort. They decided that I should be on Ventolin. I was diagnosed with asthma when I was 12, 1987, 38 years ago. Now that was a wrong diagnosis, by the way, because it's allergies, not asthma. But when I was given that diagnosis, I was given Ventolin. I was hooked up to machines over my head to help me to breathe. I was in for a 36-hour admission, and then they gave me Ventolin and was discharged. Now the Ventolin didn't work. So I had to go back, hooked up to machines again. And I had a big thing on my head, so it was, I'm not sure exactly what it was, but it was a breathing thing. And it had a mask, and it was a breathing mask and oxygen put into my body and all that sort of stuff. And they kept trying Ventolin. They tried it different ways. Tried it with spacer. They tried it with another medication. They tried about 15 different ways to do it over about 4 years. None of them worked. And we weren't sure why none of them worked. We later discovered that Ventolin doesn't work on me. Now, different doctors describe this in a different way, but I always think the most sensible way to describe it is that I'm immune to that medicine. It doesn't help me, doesn't hurt me, does nothing for me. So eventually we went up to some other asthma medications or things for helping you breathe. And we went to some that did work a little bit. And I'm not going to go over all the names of it because I'm not completely sure what each of them were. But there were ones that worked a little bit better, but I still had a bit of residual breathing problems. And kept going through, and it actually took 21 years before they not only found out that Symbicort worked, but that there was a way that Symbicort worked for me. So if I take it as instructed, it doesn't work. So Symbicort is meant to be taken 2 times a day. That does not work for me. I have to take it. I have a cough, I take it. I don't take it a certain amount of times per day. You might say, no, that's the wrong way. You're doing it the wrong way. I'm not doing it the wrong way. I'm doing it the right way for me. This took 21 years of working up to get to that level. And other medicines that I'd taken, other asthma or breathing medicines, I had to be taken in a slightly different way for me because I'm different to other people. Other people are different from each other. You have to have something that works for you. And that is what works for me. And I'm not in any way saying that's the only way you can take Symbicort. For most people who end up being on Symbicort, you take it 2 times a day or take it 4 times a day and you just take it that many times per day. That's not the case for me. It works in a different way for me. I can't explain why that works that way, but I've got a lot of allergies and I don't have asthma. It's an allergy situation. That's what I end up with. So I had, I think, around 18 breathing issue admissions to hospital until they got me onto the Symbicort over a 21-year period. So I haven't had any since then. But 2 years ago, I had a heart attack. It was my 3rd heart attack, and I went to the hospital with it. And I could call them rude words, but one of the doctors there said, "Oh, why are you taking Symbicort?" And they took it away. I'd taken 6 of them with me. So I always have a few just lying around just in case. And she took all of them away and gave me Ventolin. When they gave me Ventolin, they forced me to take it with spacer. "Oh, you take it with a spacer? You don't know how to do that." I do know how to do that, you idiot. I mean, what do they think I am? They think I'm 6? Think I'm 6 years old? Of course I know how to do it. So I took that, and they were wrong, and I told them they were wrong, but they didn't care, and then went, "Oh, can't breathe. Oh, that must be because of the heart attack. Oh, we'll have to keep you a bit longer." After 3 days of not letting me take Symbicort, I was barely surviving. And I said, "Please give me Symbicort." And they gave me one. And I was able to breathe again, so then they discharged me. I said, your heart's fine now." My heart wasn't fine. You idiots. You absolute moron. It was a problem because you took my Ventolin away. You absolute moron. And you know what's worse than this? They weren't sure what caused the heart attack. And they had like 5 or 6 different options. I'm still not sure. And I actually found out that they'd removed the heart attack part from the diagnosis. Oh, are you kidding me? Are you kidding me? They listed all the possible causes, forgot to mention what it was a cause for. Are you stupid? How idiotic do you have to be to forget the bit that I had the heart attack? A heart attack of an unknown cause doesn't mean it's not a heart attack. Are you stupid? I mean, this is a whole hospital. This is a whole hospital that had me admitted with a heart attack that was proven. Had cardiology review the whole time. Was in the cardiac ward. They weren't sure what caused it. They had different investigations trying to work out what caused it. And they removed the heart attack part. Oh my God. Oh my God. And they didn't put in, obviously, they didn't put in their incompetence with removing my Symbicort, forcing me to take Ventolin. Obviously, they're going to cover their tracks for that. But, oh my God. I mean, there's lying and there's incompetence, and this is just insane. I don't know what else they've lied about in there, but that was just insane. Were they trying to cover their tracks for them giving me Ventolin when I had Symbicort? Or were they trying to cover? I don't know why they would lie like that. It just, it just defies belief. Do they? And I mean, they said, "Oh, you had a urinary tract infection." Okay, I did have a urinary tract infection. I also had cystitis. I had prostatitis. I had a few other things going on, and we weren't sure what the cause was. And maybe that was a part of the cause. It was. There was a food poisoning guess as well. But They said, oh, you came in for urinary tract infection. I did not come in for a urinary tract infection. I'm sorry. I didn't. It was, I didn't call the hospital saying, oh, I've got a really bad urinary tract infection. I had a heart attack. I was calling and saying I've got chest pains. And they tested it. They proved that it was a heart attack. So this is how stupid this hospital is. I'm not saying that they're bad for everyone. They're bad for me. This is how idiotic they have been with me. And there have been a lot of other errors. But I haven't even seen it because I've still got a freedom of information request pending. They make it difficult to get your information. They won't tell you. They refuse to look at anything from any other hospital. I've sent it to them. Nothing to see here. They won't look. I've sent freedom of information requests. I've sent information to them. They just delete them. They just will not add things. They just refuse and then make assumptions that are wrong. And they just refuse. And they're just... everywhere else knows. They don't know. Like, oh, you could be lying. We can't prove anything. Of course you can prove everything, you stupid idiots. And so first one they said was the first one like a month ago. They said that it was a cold. And the stupid thing was that they actually had registrars who were actually competent, who said, oh, look, we'll have him under overnight observation, we'll do checks and all this. The brilliant consultant with so much experience. And I'm not in any way criticising doctors, I'm criticising this hospital. I don't know why this consultant, was it the consultant being a rogue or was it, well, I don't think it was, let's just be honest. Someone there, maybe an admin person, who I don't know who it is, has decided to order them all to treat me badly. This consultant went, stuff it. Just got a cold, bye-bye. And then, they refused to give me antibiotics and decided to give me steroids. This is with me saying, oh, but it might have been caused by steroids. Well, we'll give you some steroids. It might have been wrong. Maybe it wasn't caused by the steroids. But why are you giving someone steroids when the whole condition might have been caused by steroids? At least the total airway blockage. And again, I don't think that this is one rogue doctor. Because over the course of the time that I've seen it, I've seen like 15 doctors. You can't have 15 bad doctors working for... I can accept if there's one. You cannot have 15 unless you're just deliberately hiring the worst doctors in the world. I just don't believe that. I don't think it's the fault of the doctors. I think this is something systemic. This is some admin person. Look, it might have been a doctor that put something dishonest in my file. But it's almost like, how I used to have this alert, and in fact I still do in every other hospital. It says, red alert, special patient needs extra care. I reckon there's the opposite now. I reckon there's now, red alert, kill this patient. Because that's basically what they're doing. They're trying to kill me. With the medicine, with the lack of care. That's the end result, is that they're trying to kill me. Like this is not just mere negligence. This is... It's probably not worded as trying to kill this patient. It's probably trying to word it as don't help him, So the second time I went in, I'd only had one more of these airway blockages in between. So a 9-day gap, and then I had another one. It was terrifying because I thought it had gone. Went in there. And then on top of that, I had the thickening. Went in. Not really expecting anything because they'd already been abusive to me. This time they're actually a little bit better. And it still made me wait quite a long time. And then, so my wife originally came in with me, but then she left. She was sleepy. Didn't stay the whole night. And then I actually had a total airway blockage in front of them. It only lasts, it doesn't last a particular length of time. It lasts until I cough. Because I'm not stupid, I'm going to cough straight away. So it lasts 5 seconds. Because, I feel, because that's what you do. I'm not going to just let it go for 5 minutes because you never know how long is it going to take. You might pass. Some people might pass out in 3 minutes. They might pass out in 1 minute. I'm not going to take that risk. I cough as hard as I can straight away. And I did it straight away. It's in the waiting room. About 20 other people nearby. Now, after this, of course, it took about 40 minutes before I could breathe properly again. So I was going, just trying to mimic that. It makes me cough. But suffice to say, I was in a lot of distress for a long time, completely ignoring me. And then I went up to the triage nurse, had to wait in line. Somebody tried to push in front of me. And I went, no, you're not pushing in front of me, mate. I'm before you. So I went in and I talked to them and I explained what happened. I said, oh, we shouldn't have done that. That's negligent. Oh. Because they've been doing a handover because it happened at 8 a.m. and they do their handovers at about 8 a.m. between the people from the night shift finishing, the people from the morning shift starting. So I did their handover and they were busy partying and laughing and joking and nobody looked. Because they're actually required to always keep an eye on the waiting room. And they didn't because they missed that. I went and told them and they said, oh, geez, we're going to have to admit you do all this sort of stuff. And then the doctor came in and I'd been waiting because I'd seen this other doctor and she'd organised all this stuff. It was a wonderful sounding thing, even better than the previous one. And the consultant interrupted me explaining this to the triage nurse, brought me out, and he told me that even though it had already been proven not to be a virus, he said that it was secretly a rare virus. Didn't tell me which one. Didn't give me a guess as to which one. Didn't say, oh, this one matches it. Actually asked AI later, are there any that match it? And no. Essentially there's none. There's a few that sort of maybe do, but I couldn't have caught them because the way that you could catch them doesn't match. And there's a lot of other things about it that don't match. So essentially, if it is a rare one, test me for it, see if it's possible to have it, because these rare ones are serious issues. They're life-threatening emergencies. So they didn't test me for them, just discharged me. Not only did discharge me, pushed me out and told me, go away and don't come back. Okay. So you mean never come back to this hospital? Never come back. This is just one doctor. He can't say that, but he told me that. So I decided, look, I call up the medical records and I say, look, I want to know what the heck's going on here. Give me the medical records file. Of course, they let themselves have 2 months over. They can deny it, all this sort of stuff. Talk to them. They were actually quite nice. And they said, look, tell you what, if you don't want to put in a lawsuit, because obviously I have a pretty big grounds for a lawsuit, they said to go ahead with a complaint with what they call the feedback team. So I put this in, and obviously it's an internal thing, and everybody knows if you're an external person, you ask an internal body, they're always going to pat themselves on the back. So I knew that was going to happen. It always happens like that. Everybody knows. And so I did that. And of course, they patted themselves on the back. But one thing that I found amusing was that this feedback team referred to the surveillance footage of the waiting room, because that's 24-hour surveillance. There's a camera there. There's probably a few cameras there. No audio. But they saw me have the total airway blockage, so they knew that it happened. And they said, it's probably just a bronchospasm. Probably just nothing, just a bronchospasm. I had to Google what a bronchospasm is. I'd never heard the term. So bronchospasm is when you have an allergy that causes your airways to block off completely. It's a life-threatening emergency. It can kill you. So not just a bronchospasm, but a life-threatening emergency. Didn't really diminish it if it was a bronchospasm that was causing a total airway blockage. It didn't make it a just. It's life-threatening emergency. We're negligent to not give it to you, not do something about it. Now, I don't actually think it was a bronchospasm. I just need to say that I asked Dr. Google, asked the AI, and I've asked other people as well since then. So bronchospasms can happen when you're standing up, sitting down, lying down, whatever. And they happen when you're exposed to a particularly large amount of the allergy. Now, if the allergy they're talking about is the dust allergy caused by the building next door, I was in the hospital. In fact, not only was I in the hospital, I'd been in the hospital for 11 hours. What allergy was I reacting to? If this happened at home, yeah, okay. This happened in the hospital. Not only that, but every single one of my total airway obstructions, it happened when I was lying down. Bronchospasms can happen sitting up. So if this was a bronchospasm, and if all of them had been bronchospasms, as they suggested, it's this feedback team, why were they all while lying down? Why weren't some of them sitting up? And why did I have the one in the hospital when there was no allergy affecting me? Got an answer for that one? It's just a bronchospasm? Do you have an answer? Do you? No, they didn't, of course. And I criticised them on that. But you know what? I actually found this really stupid, because if they were told to just dismiss it all and just make me sound crazy, which is usually what they do when they're doing an internal thing, why did she admit to there being a video? And why did she admit that I'd had this total airway blockage? Well, she's admitted to that. I could win a court case based on that. So she hasn't even done a good job of diminishing my complaint. She's actually strengthened it. And if they're going to strengthen my complaint, why not apologise and try to help me out? They could have just blamed that one doctor. Just said, oh, we just have a rogue doctor. Or just, say whatever to sort of say, we're here for you, So I don't know, because I only got one answer back. I wrote about 50 things afterwards, and they never answered. Not really. So doing the Freedom of Information request now, I've got, September 19th, I think they've got until they get around to it. So still another month. We'll see if they actually get around to it and what they actually say, and whether I actually want to read it, because it's probably going to be pretty horrible. So then, after that, I was actually looking at going to a different hospital. So I was looking at one called the Royal Melbourne Hospital, which I don't know what they're like, but it's quite a long way from me. And in fact, it's not even the second closest. It's like the fifth. So to justify going there, it's hard to justify. And I mean, was I really banned, or was this guy just saying this and, what's going on? This feedback team was basically saying I was still banned, but they refused to use those words. But they also refused to say that I wasn't banned. Okay, all right, that's fine. So I was going to go to this. I thought I'd just go to Royal Melbourne Hospital, and I went to call them, aiming to go to Royal Melbourne, and I wanted to just talk and say, is it okay to go in? Because obviously it's okay to go in if I'm not from that area, but I'm in the city at the time, because that's in the city, and I'm not in a really rural place, but I'm out in the outer suburbs, so suffice to say that I could justify going there if I was in the city and had an accident, perhaps at a nightclub or the casino, or something like that, or going shopping. But just going from my house, maybe not. And they might not see me. And also, if they find out that I'm banned from another hospital, they might think they should ban me too. So I was a bit nervous about it. I wasn't sure if I should see them. Anyway, they ended up putting me through to a nurse on call. Sort of an automatic thing, and a bit of a mistake. Didn't mean to go to them. And they decided to put me through to something called critical care units. Sorry, that cough's still there. So I went there, and the person there, well, they weren't perfect. I'm not going to go over everything, but suffice to say that they weren't completely convinced that I was telling the truth. That they just went, well, why is a hospital going to say that you're lying if you're not lying? You're probably lying. I can understand that perspective, just to be honest, but they at least considered that I might be lying, which was nice of them. And they gave me a few different options for what they thought might be happening. So they said, assuming I wasn't lying, most likely I did have this cough from swallowing a chip. They said that actually what you're describing does actually happen. And you could have a twisting of the throat from being punched. And then you inhale a chip, which can get infected anyway, even without the twisting and narrowing. But it's more likely to get infected if you have a narrow throat. So what I described was consistent with what he knew. He said, yeah, that happens. I'm like, how come you know that? And the hospital doctors don't know. In fact, how come all of my GPs that I've ever seen, at least since that happened, knew? Even the bad ones, how come they all knew? And the hospital doctors don't know. You might say, oh, because the emergency department are worse than every other doctor in the world. Yeah, but these were even consultants who say, nah, you don't have that. That's a cold. So they weren't just denying my total airway obstruction. They were denying my cough. They were denying that the cough was caused by getting a chip stuck. And they were saying it's just a cold. Are you stupid? Fair enough, you can deny the airway obstruction if you haven't seen it. And the second guy was saying it was a rare respiratory thing. He didn't even talk about the total airway obstruction. They just assumed I was making up. I had that in front of them. How can you deny something that you've just seen? You know? It's not like, oh, I'm just talking about it, I could be lying. I did it in front of you guys. It's videotaped. And you still deny it. So this guy just accepted it. He said, well, you got a lot of evidence that this has happened 12 other times. Pretty likely it's happened. Yeah, obviously. Of course it's obvious. It's not a guarantee. Because you can only guarantee this with a tube down the throat, what they call a bronchoscopy. I haven't had that. Because around here, ENT, to do that can take years. So it's pretty much impossible to get that done. They just don't have tubes just lying around. A little garden hose would probably work. But they just don't have it, Probably only need a length of tube like that long. Just get a little garden hose, chip the edge off and just have a look and just put your eye in and go, oh yeah, there it is. Because you can't just say, let's go like that because it's down the bottom. So, maybe not a garden hose, but surely that equipment is not that expensive. Surely you can have a version of it. $10, $20 maybe. Maybe I should just carry something around. But anyway, so he accepted that. And then he said, well, as for, and he said everything in my symptoms is consistent with that. But he said that I should have had a fever. And he said, why didn't you have a fever? So no, I've never had a fever with it. So I'm getting asymptomatic or atypical, sorry, not asymptomatic, atypical symptoms for this. He said that might be why the hospital thought I was lying, because I'm not having a fever. But everything else about it matches. I'm supposed to have a fever. I'm like, oh, I didn't know I was supposed to have a fever. Nobody told me. So if you looked up the symptoms because you were mimicking it, which is what people do when they're lying about symptoms, I would have known I had a fever. Could have mimicked a fever. So he didn't believe I was lying. Because if I was someone that was like hypochondriac or just lying for some reason, I would have matched all the symptoms because I can probably Google it pretty easily. And I can probably put, something hot on my face and make it drip water. I wasn't doing that. I wasn't trying. I was just saying, well, I don't have a fever. Never have a fever with it. So he thought I was probably telling the truth, and everything about it, including bits that are not easily available on the internet, he said matched. And things that a lot of doctors wouldn't know about matched. So then I go, okay, well, why isn't, or why am I getting these total airway blockages. I just describe them like this, because I don't know why I do it like that, but I just I put it this way and I put the fingers together. It just makes sense to me. Because total airway blockage is not a shortness of breath, it's not difficulty breathing, it's no breath. So I am getting shortness of breath as well as part of this, but that's not a big problem. I don't care about that. That's not life-threatening. The problem is I get no breath. So I asked him about that, and he said, actually, if you get something stuck in your throat and you lie down, there's every chance you'll get a total airway obstruction. Oh, really? I didn't know that. And I asked him, then why didn't I get it the other times? This is where his theories came in. He said, first of all, were they building a house next door the other times? No. He said there could be strain on my throat for them building a house next door, and that could mean this time, because I've got the extra strain in my throat, the extra difficulty breathing, that I was getting a total airway obstruction when I wasn't before, because I should have got them every time. Okay, that makes sense. The second one, he actually thought that I was having a trauma, that I may have a trauma and I'm having a traumatic experience and a trigger, like a PTSD sort of trigger. Now that didn't actually make any sense, but what did make sense to me was that my GP, normally I'd see a GP within a day or two. Normally I'd see two GPs and they'd both give me antibiotics and it wouldn't be an issue. Having to wait 10 days, having the first one say no, having to wait 10 days to have the second one and then not being able to see him for 10 days, then having to quit was a big problem. And then having the ones that I tried to see after that refuse to give me anything made me really stressed. And that could have caused that. And the third one that he thought was that he thought that actually it was a bronchospasm. But he still thought I had the blockage in my throat from the chip, but that I had a bronchospasm from the thing outside. Now that was in order of likelihood, by the way. So the most likely was this was a secondary part of the chip, the throat infection from the chip, and with the stress caused by the extra allergy load. So that's the most likely one. The stress thing, second most likely, and we didn't really put a percentage on these things. And the bronchospasm one, the problem with the bronchospasm one is that it should have been sitting up as well. And the other thing is that the bronchospasm wouldn't necessarily be resolved by me coughing. So bronchospasm should last a specific period of time, whether I cough or not. And it should only last like a few seconds, hopefully. So it's just a spasm that goes. So it should be a few seconds. So me talking about it lasting indefinitely until I cough suggests it's not a bronchospasm. And me talking about it lasting different amount of times suggests it's not a bronchospasm. Me talking about it only happening when I'm lying down suggests it's not a bronchospasm. So we can pretty much rule that out, but hypothetically, it's possible. I've looked it out. It's at this stage with 17. I've had up to now 17. It's roughly 1,000,000 to 1. So we can realistically rule that out. But the other two are possible. So the stress thing, and I certainly have had stress, and just the simple load of that. So then I had a third thickening of my throat. And this coincided with my 17th total airway blockage. I had 2 of them in the same day. I'd gone 3 days without any. I had the air purifier. You may be able to hear this. It's an air purifier just there. And I got that because he suggested me to get an air purifier to minimise the amount of allergies in the area. So I had that. 3 days after that, so I had no total airway blockages for 3 days. Thought that part had gone away, and then I had 2 in a day, 5 a.m. and 5:30 a.m. on Monday this week. And then after that, at 7 a.m., so I still hadn't recovered from them, at a halfway airway blockage. And I said, I'm going to call the ambulance. I don't care. I'm just going to force them to take me. So the ambulance took me, and I was actually seen fairly quickly. ambulances apparently put a bit more pressure on them than if you just rock up yourself. So this time I said, all right, you've had it for 39 days, probably not a cold. All of the respiratory tests, the virus tests have come back negative, not a cold. We're not thinking it's a cold anymore. Yeah, okay. And I said, well, we're also not thinking that it's a rare respiratory virus. Okay, but it might be. Would you test me for one? Would you at least theorise one? We can't think of one that matches. Okay. Was a bronchospasm? It doesn't match a bronchospasm. Will you accept that it was probably the food stuck in the throat? Yes. Yes. Can't guarantee it, but probably. Okay. And they asked me what different people had said, and I told them, well, I told this doctor, it's a female doctor, so I should say she. Although maybe she uses a male pronoun. I didn't ask what pronoun she uses. But anyway, they. But I'm going to say she, just for convenience. So she said that she was accepting the theory of what the critical care doctor said. Oh. And then she asked me what management plan he'd given me. And I said, well, he told me to get an air purifier. He told me to leave the house as much as possible. He told me to try to convince the people to be a bit more responsible with building. They're not going to do that. I've asked them, and we've tried everything. It's just not happening. Council don't care. I've tried everything. Can't move. And said to get an ENT referral, an allergy referral. She said, I'll give you an ENT referral. Really? Yeah. So she gave me an ENT referral. I said, okay. But I can only give you a public one. I said, okay. So will that be in like a week or two? Said 2 or 3 years. I mean, hopefully this is resolved within the next few weeks. I don't know. At least, I mean, I don't really care if the cough bit isn't resolved. That's not life-threatening. But the total airway blockage is resolved in 2 or 3 weeks. But I'm sort of thinking, like, I don't know how many of these total airway blockages I can just wake up and just cough my heart out and just survive. I mean, eventually, presumably, I'll wake up and not be able to cough hard enough and just die. Because I have to cough the maximum amount. And I don't know what factors could prevent me from coughing hard enough. But eventually, you would think that there will be one that will come that I won't survive. And I'll just die. And I can't imagine going to hospital saving me, because I'd probably have like 3 minutes. And the quickest the hospital could come here, pick me up and take me back, and that's assuming that someone calls the hospital, because my wife wouldn't even wake up. She never has any other time. Would be 20 minutes. I'm not going to survive in 20 minutes. I'm going to lose my breath. I'm going to be dead. Maybe I'll be dead in 10 minutes. Even if the ambulance come within 10 minutes, which is possible. If my wife notices, maybe I'll punch her in the stomach. But most likely she'll wait until I passed out. And then she'll call. It's already 20 minutes. I'm dead. I'm not surviving that. So, ambulance is really irrelevant for this. Ambulance is not saving my life. My wife could, if there's anything she could do. She doesn't know what to do. No one knows what to do with this. So, if I wait 2 or 3 years, I'm either sitting up to sleep for 2 or 3 years, which is a bit impractical, or eventually one of these things will kill me. I don't know how many. I don't know what the odds are. But you think that eventually, and the longer time goes on, presumably my ability to cough that loud will diminish. And eventually I'll just die. So a 2 or 3 year wait to see the ENT team is insane. Not only that, she told me that the reason that the first two refused to treat me, and I think we can say they refused, was because they don't have an ENT team there. They didn't tell me that. They lied to me. They could have transferred me to somewhere else that does have an ENT team, such as Royal Melbourne Hospital, they have one. But they didn't want to. So they instead lied to me, dismissed me, told me it was just a cold, told me it was a rare virus, without evidence, to get rid of me when this was a life-threatening emergency. It needed to be dealt with straight away. They didn't have the equipment to deal with it, we've got to be fair with that. But they could have transferred me to a hospital that did have the equipment. They chose not to do that. In fact, even on the third one, she was explaining this to me, and I believe being quite honest, because it sounded quite honest, she still refused to transfer me and is telling me to wait 2 or 3 years. I asked the AI to review her performance, and they said it was bad, and yet she was clearly better than the other two, but it was still bad. Now, I then went to a GP, another one in the same clinic that the doctor I used to see, who's now left, and I got someone to give who didn't want to see me. He's like, "What are you doing this far away? It's 40 minutes away." I got him very reluctantly to give me an ENT referral. He wrote on the ENT referral, as the ENT specialist told me. He wrote and said, "Not urgent, thinks that he gets a bit of shortness of breath occasionally. Thinks. Believes." I might have put believes. I wasn't sure if it was thinks or believes. I didn't actually see it, but this is what they told me. And so they called me back and said, "We'll give it to you on the 30th of September. So this was a week ago that they were calling me, last Monday. And I go, "Okay, it's better than 3 years, but am I going to live that long? I mean, I'll either recover from this, in which case I don't need the referral. I'm probably going to be dead. I can't imagine lasting another month and a half. I mean, I've had this for a month, the total blockages bit at least, and you wanted me to wait another month and a half. Oh, it's not urgent." So I said to them, I said, "Why isn't it urgent? Can you bump it up?" He said, "Can't. It's already been triaged. He didn't put it as urgent." So then, and I'll just, I might skip ahead a little bit. A few days later, so on Friday, so yesterday, they called me back and said, "Well, we've actually had a cancellation. We put you in for next Tuesday." Now I have to travel halfway across the country to get there. I think it's about a 3-hour trip each way, but I'll get to be seen on Tuesday, which is good. That's probably good enough. And the stupid thing is, I haven't actually had a total airway blockage since. Now, touch wood, I don't want another one. So it's been 5 days now, 5.5 days, almost 6 days. And if we get to that point, and I still haven't had one, it would have been 8 days. That doesn't mean it's gone, but it could be the air purifiers removing the thing, and I'm not having to deal with the allergies, and therefore this is not happening again as a secondary. Because presumably it'd take a little while for the allergy components to go away. I still have the cough, but I'm not wheezing very much from the allergies. I'm not having to use my Symbicort. So there's every chance that it's fixed. I'm like, oh, good. Which is good. It's good if it's fixed, but it's sort of annoying. I'll have to go to an ENT and be seen, and when it's not. And I actually saw another GP. So I went to see the GP I used to see 10 years ago, or at least their clinic, which were consistently good. The only reason I stopped going there is because it's too far away and it was too hard to get to. And so I went to somewhere local that was not as good, although there's another one local that's even worse. Some bad doctors in Melbourne. So I went to see them. This guy was fantastic. And I can tell you what he said. So he said, firstly, he wanted to get my history for the previous 10 years when I hadn't seen them. So I told him I had a heart attack. I broke my foot 6 months ago. I got this. There's probably more to tell him, but that was what I told him. And I said, I'm on Holter Monitor. I'm meant to be getting a yearly review. And actually, we're behind on that. I meant to do a PSA review. We're behind on that. And I'm actually on track for my colonoscopy. Don't need another one till 2027. So not for another 2 years, is it? Is that right? Yeah. So they're meant to be getting them every 5 years at the moment. That was on track. PSA we're behind. Holter monitor we're behind. I'm well behind on allergy review. I'm supposed to be getting dermatology reviews, sorry. So far behind me, that's ridiculous. Because the other GP were hopeless. Not completely hopeless, like they had some merit, but they were not doing my regular reviews. And so anyway, so he was good, and he put in an urgent referral for the ENT. I thought, well, that's great. And then this is the second ENT place. They called me up and they said, well, we can get you in on 21st of February. What the hell? 6 months. 6 months when I've only had it for a month and like I'm nearly dying every day. 6 months. I said, well, we can do October. Well, it's still 2 months, which is worse than the other one. The other one was 1.5 months. The 29th of October, I have to travel to the absolute middle of nowhere, like a 5-hour trip, for 2 months. I'm like, okay. And she said, well, we haven't actually triaged it yet. We'll triage it. We'll triage it next week, and then we'll decide. And this is the thing, I mean, I know I'm going to 2 different GPs, I'm getting 2 different ENTs. I'm only meant to get 1. Technically, I'm actually getting 3 ENTs because I got 1 at the hospital. I don't feel bad about it because this is just appalling. But maybe I should keep seeing other GPs. Because the thing is that the hospital said they had a note to the GP. It didn't say which GP. So I could potentially go and see some other GPs and get more ENT referrals. I probably shouldn't because that's probably a bit of an abuse. But, you know, and this is the thing. Like, I don't know what they'll say on Tuesday. And they may well say to me, oh, you're cured, at least of the total airway obstructions. And I hope I am. In which case, unfortunately, they probably won't be able to help me. But in which case, you know, maybe I won't. There's no point seeing the other one, but I probably still will because because it's such a mystery. It's good to get second opinions on these things. Yeah, and I think for the moment I'll see 2 GPs, probably about 2 different sorts of things. Because, yeah, it's just. I mean, I can criticise the GPs and they made mistakes and all that, but I really do think, you know, Sunshine Hospital have been appalling. And I'm not talking about one doctor or one nurse or one person. I'm talking about as a unit. Now, I'm not saying that they're bad to everybody. They may well be absolutely amazing to every single other person on the planet. And if you've had good experiences and you're seeing this and you've been to Sunshine Hospital, fantastic. I'm not diminishing that they're not good to you. For some reason, they're awful for me. And they're much worse than every other hospital I've been to. I'm not saying that it was the doctor's fault. I don't believe it is. They've got something in my notes that is telling them to treat me this badly. And they're all, or at least a lot of them, at least the senior ones, are adhering to this. Now, what they've got in my notes could have been from one of the doctors that saw me earlier on, perhaps the one that saw me for a bee sting, or it could be just triage nurse, some random person, who knows. I don't know at this stage, but I do know that they're calling me a liar all the time. And it's not just, I don't care if they call me a liar. They can call me names, I don't care. But this is meaning that I'm not getting the treatment that I need, putting me in life-threatening situations, putting me in dangerous situations, putting me in awful situations. I'm not just going to say slightly uncomfortable. I mean, if I'm in a situation where I can't sleep unless I sit up, I can't sleep lying down for a month on end, and they're not caring, because if I sleep, I'm at risk of dying because I get total airway blockages, and them just laughing it off and not caring, and then doing a review and patting themselves on the back and then saying it was just a bronchospasm, when bronchospasms themselves are life-threatening. Life-threatening emergencies. They're laughing it off and then saying, oh, actually that was because we don't have ENT facilities, refusing to transfer me to somewhere that does, putting me on a 3-year waiting list, something that could kill me any day, it's a bit beyond. This is not incompetence. This is not one doctor that doesn't know what they're doing, that's not trained, that they've hired the wrong person. I can understand if they hired one bad doctor. I don't believe this is being caused by bad doctors. In fact, I'd argue that probably none of the doctors are bad doctors that I saw. They're people that are responding to instructions. It's the instructions that are bad. It's whatever's in my notes that's bad. And they're breaking the law. Probably breaking a bunch of different laws. They're not allowed to treat people this badly. They're not allowed to put patients' lives in danger because they can't be bothered or because someone tells them, let's save some money on beds. Let's just put in the minimum effort. You know, they're required to put in a certain degree of effort. Making me wait in the waiting room for hours on end and I can't breathe is appalling. You're not allowed to do that. So, you know, this is a massive criticism about Sunshine Hospital. Now, I'm not saying my GPs were all perfect. There were some that were pretty lazy. But I'm going to say, and I'll say this quite clearly, I've been to Royal Darwin Hospital. I've been to Alice Springs Hospital. I've been to Launceston General Hospital. I've been to Burnie Hospital, and then when it changed its name to Northwest Regional Hospital in Tasmania, this is in Burnie. I've been to, well, obviously when I was a child, I went to Royal Children's Hospital. I went to Monash Medical Centre. I went to Box Hill Hospital. I went to Royal Melbourne Hospital. And on top of that, I've worked in a number of hospitals as well. And I've actually worked at Footscray Hospital, which is a partnership of Sunshine Hospital. Footscray Hospital was pretty terrible to work for, but I'm not going to go into that. But suffice to say, none of the others were even close to as bad as this one. So I've had 18 years working in hospitals. They do vary. There are some that are not that good, but none were this bad. This is a level that is unconscionable. I know you shouldn't be putting these things on YouTube as it stays on there forever. I'm putting this in because I'm in a situation where I could die any day. I could have one of these total airway blockages and die. And I'm not lying. I'm not saying anybody's names. I'm saying the hospital name. And these are my opinions. These are my experiences. So, you know, I don't think you could sue me over this for defamation. I don't think it meets the definition. I'm not in any way saying that Sunshine Hospital is bad overall. They could well be the best hospital in the world, but their treatment of me has been appalling. So the worst hospital for me, at least of the ones I've been to, and I've been to a lot of them. Now, I've been in emergency departments since I was a baby. I've had gaps where I didn't go because I managed to avoid certain things. But I've had a lot of admissions. You know, I've had a lot of serious admissions. You know, there's a lot of issues that I've had to deal with in my life. And I've experienced different levels of care. Not counting Sunshine Hospital's woeful behaviour. The worst that I've experienced was at Burnie Hospital. I was 12 years old and I was diagnosed with asthma. This happened after I went for a jog. I went for a run with a friend. He was about 15, he was 3 years older than me. He said, "I heard you're good at running." So I tried to show off in this macho way. And he ran so fast I couldn't keep up for about 2 hours. And I started wheezing. Now, of course, he was like, "Ha ha, you're too unfit. You can't keep up. Oh, what a wimp." You know, as guys do. And then I wouldn't stop wheezing. I thought it only lasted a few minutes. And eventually, after a couple of hours, came home. And I had to walk. I was struggling to walk. Couldn't breathe. We sat down and thought that had calmed things down, gave me tea and different things. Didn't calm down. And after, I think it was something like 6 hours, we went, well, this doesn't seem to be resolving. We all thought it would resolve. I thought it would resolve just by calming down. I'd never had asthma. Never had any breathing issues. So we went to the hospital. and they fitted me up to this breathing thing, as I explained before. And then he discharged me with Ventolin, declaring that I had asthma, even though there was nothing to suggest I had asthma. And he was wrong. I didn't have asthma. I had allergies causing difficulty to breathe. He gave me the wrong kind of inhaler, caused me to have 18 hospital admissions. Now, I was nowhere near dying on any of them, and they treated me very well at all of them. But he made a misdiagnosis originally that caused a lot of problems for me and a lot of extra stress on hospital staff. Had he diagnosed me correctly to start with, perhaps I wouldn't have been put on Symbicort straight away. I think probably needed to have a workup for it. But it probably wouldn't have taken 21 years. It's a very long time. And I wouldn't have had difficulty breathing for 21 years, which is very annoying. And I probably wouldn't have had as many as 18 admissions, which is very taxing on hospitals, and it probably costs a lot of money, and I'm not sure how much admissions cost. I didn't actually go in, I didn't go overnight every single time. I think I only did 3 times. But I had 18 attendances, had to be hooked up to breathing equipment and all that sort of stuff. Now, you might excuse that behaviour, and I can excuse it. It was a mistake. I think it was a bad mistake, and I don't think it was all that excusable. I think it was pretty bad. That doctor, and I don't know what his name was, no idea of, it's so long ago I can't remember. I was 12, it was 38 years ago. So, that was a bad mistake. And that was the worst error that I'd had in my care until I came to Sunshine Hospital. Every time that I've been seen at Sunshine Hospital, besides the time when they bandaged my toe, which is probably about on the same level, every other time was worse than that. Every other time. And it is getting worse, and these last 3 were far worse than any of the others. Now, admittedly, the second one was the worst of the 3. The most recent one was the best of the 3. But those 3 were still appalling. They've ignored my established medical history that they have access to. They've been sent, and they keep ignoring it. I'm not saying this individual doctor, I'm saying the hospital. The hospital have these notes. They have access to them. They keep calling me a liar when these are proven facts that they have access to. The things that people don't lie about these things. So just assuming I'm lying. What's the benefit of it? Well, I get access to antibiotics. I get to stay overnight. I mean, don't people lie to get drugs or something? Well, what's the benefit to it? And it's just stupid. So someone there, and I believe it's only one person. I'd be surprised if it's more than one. Maybe it is 2. But I reckon there's one person primarily that is responsible for this. I don't know who that is. May well be a doctor, but I'm guessing it's more likely to be an administrator. Someone made a serious error that nobody's challenged. Nobody's tried to correct. They know it's wrong, and they continue to do it. So I'm not saying Sunshine Hospital is a bad hospital. I don't know. I looked online, they seem to have a good reputation. But they are so far worse than the worst I've ever dealt with that is a disgrace. They put my life in danger. You might say, that's harsh. Hospital's there to save your life. Some of their actions have actively made it worse than if I hadn't gone in. And in fact, all 3 of the last times, in fact, probably the last 4, I would have been better off not to have gone in. They actively hurt me. And really badly too. And it's completely ridiculous. There's obligations that they have and they're not meeting them. And there's more than just these 4, there's been a number of them. In fact, the only one really that I can say that they helped me even slightly is the one that they bandaged up my toe, not my foot. And, actually for the heart attack, they did help me a little bit. They also hurt me. So there's probably 2, they did do a little bit of help. but they didn't do as much as they should have with the heart attack. It was pretty poor care. But it probably, yeah, they weren't actively hurting me. But the other ones they were. And this is a disgraceful thing from them. And for them to turn around and do a review, even if it's an internal review, which are absolute jokes, by the way, across the board. Nobody does actual internal reviews that actually do anything. Even though it was an internal review, patting themselves on the back, just a bronchospasm. We triaged you perfectly well, completely correctly, they told me. Yeah. No, you didn't. No, you didn't. No, you did not. No. No, no, no. And you're not supposed to watch someone have, I mean, I'm not going to call it a near-death experience, but a time when they almost died, and discharge them straight away and tell them not to come back. Not treat me. Like, this is just insane. I have a total airway blockage in front of them, which could have killed me. They're required by law to help me with that. Should have had people rushing out to help me, give me a Heimlich maneuver or whatever and all that, rushing out. Instead, they ignored it. It's caught on camera. They ignored it. And then while I'm explaining it, they kick me out and ban me. And then when I ask them for a review of it, they pat themselves on the back and say that they did a good job. And then say, just a bronchospasm, which is itself a life-threatening emergency. That still requires them to, help me out in a slightly different way. Just a bronchospasm. We did a great job. They didn't do a good job. They did a horrible job. And if they want to bury it, perhaps don't admit that it was a bronchospasm. Don't admit that it was caught on camera. And there were witnesses there too. Don't know if anyone's going to speak out about it. There was nurses, there were other patients. Didn't even need it to be videotaped, but they know that happened. And for that alone, I mean, I'm not going to, this is the thing, realistically, I'll only win a court case of a substantial amount if I die. And it's probably not really worth going ahead with unless I die. And I kind of don't want to have to die. Rather not die. And I know my family, they're not going to want to bother with it if I die. So they're probably going to get away with it. But it doesn't in any way suggest that they deserve to get away with this. And if people from Sunshine are going to watch this, and they want to sue me, go ahead. Never lost a lawsuit, so go ahead, sue me. But also, I'm not saying this with a callous disregard for truth. I'm trying to say this honestly as I can. But this is the thing. I think if you're watching this, you can sue me. If I'm still alive, I'll fight it. And that'll expose you. And you probably know what happens when you sue someone for defamation when they haven't defamed you. I can give you a lot of examples of how bad an idea that is. But I think that, I mean, Ben Roberts-Smith, for example, just look that name up, by the way. But realistically, why don't you actually improve your practices? Even if I'm the only person in the world that you've treated this badly, maybe look into why you treated me this badly and try to improve your practices over that instead of just trying to sue me or whatever you're going to do. If you sue me, I'm going to win. Of course I am. And the discovery is going to show all the terrible things you've done. And I'll make sure that the judge doesn't suppress anything. I'll make sure that the newspapers get to come into the court. They'll find out all the stuff you've done. And you were going to lose. So, go ahead. Sue me. Maybe you can ask me to take it down in return for being better to me. And I might do that if you treat me better. You treat everyone better. And I don't know, maybe you're treating everybody else perfectly already. But I suspect you're not. I suspect You're probably doing this to at least a few other people. I don't know why you're treating me this badly. Maybe we will never know. Anyway, that's all from me. Bye bye now. And hello if anyone from Sunshine is watching this. Sunshine Hospital, I hope that you take action against this abusive behaviour by your hospital. Thank you. Bye bye now.